These approaches will allow us to develop a comprehensive and multi-level understanding of TB in the Bawamor region. And through this, we can strengthen the evidence base for public health strategies that support the local TB control program. Thank you.
Thank you very much, Tanya. Jan Douglas, please.
What do hundreds of thousands of middle-aged women and young people living in developing tropical countries have in common? Many of them, very many of them, carry a risk of developing a disfiguring and debilitating disease called lymphedema, which you may recognise as elephantiasis. This is caused for the women by breast cancer treatment, so they have lymph nodes removed from their armpit. For the young people in countries like Myanmar, where I'm conducting my study, it's because of a parasitic worm called lymphatic filariasis, which lives in the lymph system. In either case, the lymph system is damaged. If you imagine every cell in your body living in a nice, warm, watery bath, blood vessels like the tap, nice nutrient-rich fluid coming in, the lymph system is the drain. It takes away the fluid and harmful substances. So when there's something wrong with the drain, things build up in the bath water. That initiates a biochemical cascade that changes the actual structure of the tissue. Then we have the swelling, usually in the limb, and a whole lot of later stages with the thickening of the skin where the name elephantiasis came from. It's not curable, and if you leave it until it advances to those later stages, it's really difficult to treat. But it actually can be prevented. And this is where research in the breast cancer patients is going. We monitor them now after the surgery. We've got devices that can measure tiny little changes in the connective tissue. And then we implement early intervention, and they don't need to develop any problems at all. Nothing like this is being done for those young people at risk of lymphedema in the developing countries. So I took these devices to an area in central Myanmar that's endemic for LF, and I've got 50 young people who are infected and a case matched with 50 uninfected cases. And I've taken a whole lot of physical measures of them. We've taken blood from them, so we've got plasma samples. And when I get to analyse that huge amount of data that I've collected, I'm sure that we're going to be able to pinpoint that optimal time to make some kind of early intervention. And I'm hoping that out of this research that we can actually shift global policy on the management of filarial lymphedema from where it is at the moment to only paying attention to the later stages. I want to shift that in the same way that we're doing for our breast cancer patients into a preventative model, and hopefully millions of young people around the world will then not be faced with a lifetime of disability and social exclusion. Thank you.
Thank you very much, Jan. Anna Gold, please.
Hello everyone, I'm